Hi everyone, I'm Daniele Martinelli, neurologist and headache specialist from Pavia in Italy.
I'm Freda Dodd-Glover. I am a neurologist from Ghana.
And today we are here because we would like to introduce you to the regional outreaching program of the IHS. This program was developed over the last 5 years in order to achieve the WHO goals to improve neurological access over the globe. It is a program which was developed in order to observe the condition of neurological access and to start new initiative in order to promote headache medicine at all level. So we partnered together and we started to develop some kind of very challenging promotion of headache with primary care physicians. So what did we do over the last 4 years?
Right. So the very first thing we did in the year 2022, under the leadership of our past president, Professor Cristina Tassorelli and Danielle, and also with the support of the Dream Team from Malawi, headed by Massimo Leone, we went into Malawi with the aim of teaching the very primary care level clinical officers in Malawi. We had teaching courses that were didactic. They learned how to take a history on headaches. They learned how to examine patients, and they learned some hands-on clinical skills as well.
Fundamental to think about the possible of task shifting, acknowledging the lack of neurologists, the lack of physician. The idea was to develop a program targeting clinical officer, which are non-physician clinicians, in order to be able to reach the most of the population which are actually are not having access to other physicians. So basically it's working at a primary care level. And why is it so important?
It is very important because in Africa, unfortunately, even though the WHO recommends that you have one neurologist per 100,000 people, in Africa we have about zero 0.2, which is very inadequate. And most of these people, they live in the rural areas and they need to travel long distances to go into the urban areas to seek medical help. So they either do not go at all or they have to see the primary healthcare physician. This includes the community health nurses, the clinical officers, and if they are fortunate to be in a peri-urban area, they may see a general practitioner. The problem, however, is that the education in headache is very limited, even among this cadre of staff. So they get misdiagnosed a lot and they end up buying a lot of over-the-counter medications, which also increases the risk of medication overuse headache. So it's important that we teach the people at the primary care level or the grassroots to understand and grasp headaches so they can make the correct diagnosis and prevent these complications.
And be able to do that, it's very important to create partnership because as an international academic and scientific society, it's extremely important to have also local partners, which can help us to reach the government and the different healthcare providers in order to really create a fundamental change in the educational program for this, for example, clinical officer. Otherwise, they actually didn't get one single hour of education. And when we developed these programs, we were also testing our pupils, and we actually were really able to understand that the lack of proper information was really creating a frustrating situation for them, which was creating difficulties in the differential diagnosis. So making the chance for them is also through education. And ROPE initiative developed by the International Headache Society is something which is really exportable to other countries outside Malawi.
Definitely. And I would like to stress about the point you made about collaboration. It's very important. We were able to make headway in Malawi because of the Dream Team, which is the disease relief through excellent and advanced means, which has been in Malawi for a very long time. And they take care of persons with HIV and other non-communicable diseases. So it was very easy to rope headache into this. And this is going to ensure sustainability, which is very important because we will not be there all the time.
Starting with a communicable disease, now we can develop a program like we did in non-communicable disease. They have the experience, and then we can add more and more educational program based on that. Partnership is the key for success. and to develop a better healthcare and a better headache medicine over the globe.